Highway Driver. I wanted to talk to you about preparing for your DOT physical. First, you should bring the following things with you: your current DOT card, your driver's license, glasses if you need them to drive, a list of your medications and doses, hearing aids if you need them, name, address, and telephone number of your physicians. If you have heart disease, diabetes, seizures, or a sleep disorder, you will need additional documentation. Heart disease. If you take blood thinners such as Coumadin or warfarin, bring documentation that you are within normal range for the past 3 months. If you've been diagnosed with heart disease or had a heart attack, bring a copy of your most recent cardiac stress test completed within the past 2 years, along with a clearance note from your physician. If you've ever had heart surgery, valve replacement, bypass, angioplasty, or a stent, bring a letter from your cardiologist clearing you to drive a commercial vehicle. If you have a pacemaker, bring documentation of an annual pacemaker check. If you've had heart valve surgery, bring a copy of your echo done within the past 2 years. Diabetes. If your diabetes can be controlled by the use of oral medication and diet without the use of insulin, then you may be qualified under the current rules for 2 years. If you have type 2 diabetes, you're required to bring documentation of your A1C performed less than 3 months ago. If you have type 1 diabetes or use insulin, bring a copy of your waiver if you have one. Or, instead of a waiver, new regulations now allow certified medical examiners to grant medical certificates to drivers with insulin-treated diabetes mellitus, ITDM, for up to 12 months. Before doing so, your healthcare professional who manages and prescribes insulin must fill out a new ITDM assessment form and provide it to you to give it to the DOT medical examiner. The treating clinician must certify that you maintain a stable insulin regimen and proper control of your diabetes. The DOT examiner then must decide if you meet FMCSA's physical qualification standards and can operate commercial motor vehicles in interstate commerce. The FMCSA says drivers should not be certified if they have certain complications affecting their eyes, either severe non-proliferative diabetic retinopathy or proliferative diabetic retinopathy. In addition, a severe hypoglycemic episode, one that requires the assistance of others or results in loss of consciousness, seizure, or coma, is immediately disqualifying. If you have been diagnosed with seizures or epilepsy, bring documentation from your treating provider that you've been seizure-free without medication for 10 years. Sleep disorders. If you have been diagnosed with sleep apnea and are using a CPAP machine, you must bring in the last 3 months usage compliance report. DOT requires that the machine must be used a minimum of 4 hours per day, 70% of the time, in order to be certified. Additional testing or information may be required by your federally certified DOT examiner. Thanks for watching. If you have any questions, please call us at 800-332-6620.
Are you looking for a CDL driving job in New England? Highway Driver has local driving jobs with no heavy lifting, great pay, and full benefits. To apply, please click the link in the description below.